multiple sclerosis. May of 2015 was the day that changed my family forever. My cousin, who was a year older than I am, was diagnosed with multiple sclerosis at that time. We were all shocked. We began to look for information because we figured we had no family history and were unsure of how it could have possibly been contracted or what multiple sclerosis even was. What is it? Better known as MS. It is an immune-mediated process, and it affects the central nervous system. Which is made up of the brain, the spinal cord, and the optic nerve. We began to look for reasons that this could have happened, how he could have contracted it. We found that over 2.3 million people worldwide are affected by MS. It's a huge number. We had no idea. We found that there are 4 different types of MS, and during this speech I'm going to introduce you to those 4 types, the multitude of symptoms, the identifying factors, and the treatments available. The first type of MS is relapsing remitting multiple sclerosis, which responds to treatment and resolves, and then the resolution of the treatment can last for weeks or years, but it will return. Secondary progressive multiple sclerosis, which is the most common type of multiple sclerosis there is and what most people are diagnosed with. This is what my cousin has. It's diagnosed when they're unable to go into full remission and the patient is progressively debilitated. There's primary progressive multiple sclerosis, which progresses over time without any episodes of remission or improvement of symptoms. It just continues to debilitate. Lastly, there's progressive relapsing multiple sclerosis, and this is when a patient increases symptoms and has intermittent episodes of remission. Some of the symptoms with MS that my cousin has experienced are weakness and numbness. He has fatigue. He gets vertigo. He does have dizziness. The tremors from time to time, but they're intermittent with him. Muscle spasms. He gets painful muscle contractions and loses coordination. Thank God he has not been paralyzed. He does have double vision and blurred vision, but has not lost his vision. He's never had slurred speech, but it is one of the symptoms. People either have urinary retention or incontinence, erectile dysfunction, and thankfully he's had no pregnancy issues. What I showed here is the non-affected brain versus the MS-affected brain. There are 4 types of testing. As you can see here, an MRI is the most common type of testing and shows the best for diagnosis. There are also blood tests. There's lumbar puncture, and there are evoked potential testing, but MRI is always the clearest test to show MS. There are multiple different types of treatment for MS. Physical therapy, which my cousin has been undergoing for quite a while. There are muscle relaxants, corticosteroids, the plasmapheresis, which is a type of blood transfusion, and there's intravenous infusions that are also available. My cousin has only had the first 3, and we're looking at the plasmapheresis at this point for him, but we don't know that he's going to be a good candidate. This is my cousin and I when we were children, and like I said, we're only a year apart. This was him in Disney right before he was diagnosed, and this is the most recent picture of him on the end with his wife and his granddaughter. He is in a wheelchair now and has been for a little while. Hopefully you will never have to be faced with having multiple sclerosis yourself or a family member that has it. But if you do, hopefully showing you these signs and symptoms, the diagnoses, the progression, the different types of treatments and testing all available for MS will help you. In conclusion, MS is a severely debilitating disease that can affect anyone, anywhere, any nation, any creed, any color. It is treatable, but incurable. It affects the quality of life, but not the quantity of life. So people do live. And this is due to many medical breakthroughs, like the testing that I showed about. Hopefully, you will never have to deal with that. But with 2.3 million people, you'll probably come in contact with somebody who has it. So, I hope this was beneficial for you, and have a great night.